You all right? Oh, okay. There you go. Your elbow, see if you can. There you go. Oh, there it is. Nice. That, all of that. Yeah.
Yeah. So I've had 13 knee surgeries.
Okay.
The last 2 were high tibia osteotomy.
Okay.
And then I've broken fingers and toes, playing football, things like that.
Okay. Shoulder is the biggest thing going on, shoulder and neck?
Yeah, I've lost a lot of mobility in my shoulder to the point where I can't.
Show me that's as much as you can bring it up? Okay.
And I used to be able to do high pulls. This one's
that's it.
not far behind, but yeah.
Okay.
So.
And have you've been to chiropractors for that? Have they taken imaging of your shoulder?
Not so much the shoulder. The chiropractor I'm currently seeing focuses, traditional spine and neck.
Okay. So whether you're laying down or upright or laying down, you can't lift your arm up. They call it frozen shoulder. Have you heard that word before?
Yes.
Okay. So the shoulder's been frozen. Have you been to doctors and nobody wants to treat the shoulder? Nobody's been working on it?
I've gone through. After I did have 3 shoulder surgeries.
Got it.
So I had the bicep tendon relocated.
Okay.
The labrum repaired twice, and the joint capsule reshaped.
When was that last surgery? When was the most recent surgery?
6 years ago, maybe 7.
Okay, and after that surgery, you went through physical therapy. How much range of motion did you, at the best you had after the last surgery? Were you able to lift your shoulder and then you've lost it, or even after
maybe 70%? And I, continue to do the exercises. I'm in the gym 5 to 6 days a week.
Okay.
So I'm putting in the time, stretching and lifting, and it's just getting worse and worse.
Gotcha. Okay, so this last 7 years or so, 6-7 years, you've been losing range of motion in both shoulders. Okay. Numbness in the right hands or
the arm.
Right
Sometimes
arm?
I'll get it through the arm. It's occasion, not all the time.
And that has been for longer than the shoulder, or when do you think the arm?
Same.
About the same time?
About the same time, yeah. And then about 5 years ago, I had a partial tear of my bicep tendon down at this end, not at the top end.
Well, there's obviously a connection between the nerves in your neck and the health of your shoulder. Mm-hmm. So where in the health of the cartilage, the health of the labrum, the health of the tendons, the health of all the biceps, all that comes from the nerve in your neck. And so numbness is basically the nerve saying bye. It's saying I'm leaving. And so we call that atrophy. A means without, trophy means nutrition. So when you're losing a nerve, the nutritional hookup to the arm is going to fall apart. And then it'll get to the point like a flower with no water. You just barely touch it and it crumbles, So it's like, well, my arm fell apart. Well, yeah, but it was because it wasn't getting the nutrients it needed from your spine. So it's great that your chiropractor's been focusing on your back, because ultimately, yes, the spine is what nourishes your extremities, but that doesn't mean we can't work on the extremity. And especially if you've lost that much range of motion, you do, in fact, need to go into the shoulder and work on it to try to restore that a little bit. Inch forward to the head. All right, yeah, we have the shoulders tilted, the right shoulder's a little bit elevated.
Yeah, you keep saying I got, horizon on my right?
Right hip is high. You're in, the body is trying to get away from one side.
Mm-hmm.
And so that essentially it's not really so much a shoulder tilt as a head tilt. So when we have an injury to one side of our head, our neck will tilt, and then to keep your eyes level, your shoulder will drop. And so it's essentially, there's an injury on the left side of your neck. And now what's happening is, because this injury on your left has happened, you're pinching the right lower, which goes to your arm, if you can see that.
Yep.
But essentially, you're going to grind the right lower part of your neck because of this injury on the left side of your neck up here. And then that's creating a domino effect down to your hips. The hips are just going to go out of alignment as a result of the head shoulder not being lined up. It'll go all the way down to your, the weight on your feet, for instance, will be not correct. So the weight should be on your heels, and the more forward our head goes, the more weight goes to our toes.
Sure.
Knee problems, plantar fasciitis, shin splints, bunions, drop metatarsals, those to me are all events that happen as a result of our body trying to alleviate pressure in our spinal column, and then it creates extremity issues. And then you get pain in the shoulder, right in here. Is there any pain, or is it just stiff?
Stiff, and I know my levator is, just taking over, and all of a sudden, I start doing this if I want to get higher. But in order to keep my shoulders down and try and raise my elbow, I can't.
So there's no pain, it's just frozen?
There's pain, but yeah, it's tolerable.
Okay.
I do get to the point where and this happened 2 years ago here, actually, I couldn't even use this hand.
Any pain when you do that?
No.
Okay, look straight forward again for me. Okay. And, we're going to have you just do that again, but slowly for me, slowly. So you have a couple creases, but the first crease is the lower neck, but look straight forward again. But you do have some bending up here, which is good, but definitely the majority of the bending is happening. So where the skin folds is also where the vertebrae underneath are folding. And this is where a lot of my care primarily focuses on getting your upper neck working as best as possible, and also your upper back. Take stress off your lower neck. The lower neck is your shoulder. So as much spinal pressure I can take off the nerves that go to your shoulder, the better you're going to get. But then we do need to go into the shoulders and work on them. My father, this is from the training, my dad's 67 years old, and his focus, my dad's a chiropractor, and his focus that taught Brenda and I is to, as much as possible, leave this area alone. And as much as it might be subluxated, the body, it'll be crooked because the body's trying to find position of comfort. It can't be helped in and of itself by being adjusted. I believe that it's mechanically overworked, and that's why it's inflamed. Mm-hmm. So in the same way, your body did a lot better than mine, but guys lift weights and their muscles grow bigger, sure, right? And you abuse your skin and you get calluses on your skin. Sure. In the same way, if we're only bending in one area a majority of the range of motion, the bones will grow. It's not a degeneration for a bone to get bigger. It's adapting in the same way that a muscle adapts to a stress and gets bigger, or your skin adapts. So I don't like the term disease because it's not, the body intelligently grew that bone. Sure. And the cartilage, we don't call it, if I take a piece of bacon that started off as soft and flexible and I put it on a stove and cook it, and it becomes hard and crispy, mm-hmm, we don't say that bacon is diseased. Right. You said, I don't like the terminology, it's not correct. You've abused it, right? But it's not a diseased disc. It's been overstressed. It's actually the healthiest mechanical part of your spine in terms of function. Mm-hmm. It's been the part that's functioning, and so I don't see how focusing force into it, it's already moving too much. So there's no discs between the skull, or we call the occiput, mm-hmm, and the atlas, and then the atlas sits on the axis where there's a little pin that goes up into your atlas. So the way we're designed to turn our neck, and this model does a really good job of illustrating it, is the upper neck is supposed to be the main mover, mm-hmm, and the lower neck doesn't really move much, maybe 5 to 10 degrees down here, and a majority of your range of motion is supposed to be occurring in the atlantoaxial, atlanto-occipital joints up here at the top. If this area isn't working, the lower neck will overwork. If the lower neck is the initiator of the motion, you're also going to wear this out before you wear out this area. Mm. When you initiate range of motion in normal anatomy, the upper neck should move first, 45 degrees, so about 60%. All right, so you're supposed to have 80 degrees total. The textbook is 160. You're saying 80, 80. But 45 to 45, so 90 degrees should only occur at this joint. And it's the first 45. So essentially, if I took a motion or video fluoroscopy x-ray of my spine, you should see just the atlas move to 45. Hmm. When I go from 45 to 50, C2 rotates. 50 to 55, C3 rotates. You're saying up to 80 at the end, now you get the lower neck involved. How then is it able, how did we damage the discs in the lower neck when they're only supposed to be utilized? It's like making U-turns. How often do you make left and right turns in your car? Sure. Often. How often do you make U-turns? Not that often, right? So the lower neck should be involved with U-turns, and this should be involved in just turning left and right. A majority of your time in the car this is supposed to be the main engine. So essentially you were using this area to make your left and right turns. Mm-hmm. You weren't using the atlas. And so that is the problem. The lack of you functioning up here, mm-hmm, is what's resulting in this being injured. Another concept is that when there's a curve in your neck called the lordosis, so the more arch that's in the neck, and this model does it a little bit, but the spinuses are bifid. They have like two little points on them, and they actually, the blade of the lower vertebrae will actually lock into, mm-hmm, the slot, right, of the upper vertebrae, and that prevents motion. Sure. When there's a curve. And this is what the Denerol is aiming you to. We're trying, what that does is it actually it forces the upper neck to be the primary mover, because this is now interlocked with itself, and the only way then to overstress the lower neck is you have to first reduce the curve, sure, make the spine ortho, and make the alignment incorrect, which is the first preceding thing that happens when we're 5 to 20 in school. We lose the alignment, which unlocks the lower neck. The head goes forward, which locks the upper neck, and then we grind the lower neck down. But the overstressed lower neck, I caution heavily care on that. It's injured because it's moving too much. Over, bend both the knees for me. Feet flat, there we go. I'm gonna help you do a little sit up for me. And breathe in, let all the air out, let your back relax. Deep breath in, 2 more. Here we go, exhale. Yeah, way too tight here, I got you. A little bit of motion, but exhale. Yeah, nothing, okay, all right, we'll get it. So, the non-functioning T1 through T4, the first 4 thoracic vertebrae I tried to move there, them not working is the reason, or a part of the reason why your lower neck is injured, right? So this area not functioning, and I presume in a second when I feel your neck, or at the very least the upper neck being tighter than your lower neck is what's allowing your lower neck to be injured, and then the lower neck is your arm. Bottom leg bent straight, there we go, there we go. I got you. Bring the shoulder forward a little bit for me. There you go, perfect. Just gonna breathe, I got you. It's okay, I got you. Easy, easy. There we go, breathe for me. Exhale. Exhale. All right, it's just real tight here. Yeah, really, really tight. We want to loosen up that SI joint, and you're real tight on this joint, which then makes the lower back more likely to overwork. So the goal of that adjustment is to not hit this guy. We want to adjust the SI joint. It's like, well, Ed, if you spend 20 minutes massaging me, my bones will move. It shouldn't require a 20-minute massage to get your bones moving.
Right.
So I'm adjusting you cold here. I'm like undercover boss. I'm just coming in,
Got it.
seeing who's working, and it tells me understanding of how your spine is. There we go. All right, breathe for me, and exhale. All right, this hip's moving. All right, face up for me. Okay. Give me 1 second here. Yeah, that's what this bumps here. I don't find them coincidental. This little lipomas and stuff like that. They happen in areas of restrictions, either from, like I said, a contact injury, something is making things not flow properly. But here's this injury on this left side of your neck right here. There's a bump over here on the left. I'm not going to adjust you for a second. I'm going to show you what I mean by an upper neck adjustment. So the occiput is right here. The atlas is tucked up underneath the occiput. An upper neck adjustment means that almost all of my contact is up here. That makes sense? A lower neck adjustment would be my hand is in your lower neck and pushing in your lower neck. And that's what I would caution, that the focus of the force. All right, so we can sit here and argue semantics. The lower neck is going to move a little bit. Do you understand? It is impossible for me to only put force into your upper neck and for the lower neck not to move a little bit. Now, that does not mean that we can't be as careful as possible to put as little force as possible into the areas that we don't want to put force into. That's why we use the word adjustment and not the word manipulation. The point is that we don't want to be putting 90% of the force into the parts that are already overstressed to begin with. All right, easy, easy. I got your head. I promise it won't hurt you. I got you. Easy, easy. I got you. I'm waiting. Relax. Okay, it's okay. I got you. All right, yeah. I'm tight there. It's okay. I got a car and a clutch pedal. I'm seeing where the edge is. Okay. Go back to this side. There we go. All right. Here. Relax right here. There you go. Okay, I learned you. We're trying to loosen joints. The whole purpose of the adjustment is to mechanically unlock an area. We cannot change. It took us 100 years as chiropractors to research and show that the position of the bone cannot be altered permanently through adjustment. So the purpose isn't to undo the position, to reduce subluxation is what they would say for 100 years. That the purpose of the adjustment ultimately is to make the spine malleable so that the stretching can fix it, so that laying on a dental can fix it. And if we don't have your spine unlocked, then any stretching you do, heaven forbid, might only happen where you're loose, right? So then there's a danger there where now we're just further upsetting the parts that are loose, and we're not involving the parts that are tight and frozen. Now I got it, but it made a clunk there. It was a much louder sound because the gap, a much bigger, what we call subluxation, bigger misalignment on the left, and we got to get over to the left side and then get off that right side. But this knot right here is an injury. Your body thinks, a collision's going to happen again, but I would want to try to encourage you to leave the lower neck alone as much as possible. It is injured because it's hypermobile.
Should I not put the dinner roll at the bottom?
Never. Here, I watch. Piece of paper. If I keep folding this thing back and forth in the same crease,
Sure.
very.
Like
That's
a
what
paper
you're-
clip, right? Yeah.
That's
You're gonna wear
watch.
it out.
Right, I can just. Where's it going to tear? It's going
You
to
can
tear.
control the tear. Yeah.
Control the tear right where. Well, for the most part, right where the tear, right where I weakened it. Right.
Yep.
So, I don't want to be putting the dental in that lower neck. That's
Okay.
where all the bending's been occurring.
Yep.
My goal is to create a new fold. I want it folding in a place that hasn't been folding.
Gotcha.
See, it's much softer over here. Feel the difference?
Oh yeah.
It's way soft. I'd actually spend a majority of your visit on this guy right there.
I can feel that knot in there.
Yep. It's. We got to go left. And on the dental, I would actually have you back and to the left. So I'd have it up here in the top part, upper neck, and then a little bit of left rotation for about a month, and try to get me some extra pressure. That'll take the pressure off that right shoulder, and we work on that left upper for like a month.
Because when I'm on the dinner roll, I can't say it's comfortable.
Okay.
It-
Is it upsetting the lower neck though?
Yes.
All right, she whiz. You can't do it.
So
You're
I'm
not-
there, and the answer or the reason is that it's stretching the tendons so that I can gain mobility higher up. It's uncomfortable, like it's
All right.
being
I
overextended.
want you to compare and it is. You're exactly correct in your assessment. You're bending too much where you've been bending, and it's like having a sprained ankle and then we're further spraining it. You
Right.
understand? You have a sprained lower neck. That's why there's bone spurs. That's why the discs are injured. It's hypermobile. Everybody acts as if, well, it's disease. I'm like, well, it's accelerated aging.
Right.
You've aged it at double the rate because the area's done double the work. It's not a disease. The candle that burns twice as bright burns half as long. It's not a diseased candle.
Exactly.
It's like if your tire on your car isn't on straight, you wear the tire out unevenly. You don't call up Michelin and say, I got sold a diseased tire.
Right.
They're going to say your alignment's wrong. And so in the same way, the alignment and mobility that your neck is in is putting excessive stress on your lower neck. And it's not a disease. We got to throw that word away. I hate it. It's not a disease process for a bone to get bigger. If you call that a disease, you have to call muscles getting bigger diseases, okay? They're the same thing. They're adaptations to stress. My dad was injured by that, by the way. That's why it's a little personal to me.
Sure,
Because it's
sure.
like my dad was injured by chiropractors that kept doing that. And it's not the medical world that hurt my father, and then chiropractic was the white knight that came in and saved the day. It was over an abundance of adjustments in my dad's injured areas before he was a chiropractor, when he was a young chiropractor, that permanently hurt my father. And so as a teenager and as a young boy, I learned to work on my dad around his injuries was the only way I could help him.
Wow.
And so since I was 13, so for 26 years, I've been working above and below, and that's what's helped my dad. And he's 67 now, almost 67, just saying that's, and any care focused on where he was injured only ultimately made him worse. Now, it feels better temporarily sometimes to be worked on where you're injured because it stimulates the mechanical nerves. It can give us some relief. But long term, you're just mobilizing the area that's already too mobile. Yeah, right there. All right. So the goal is to go to the edge and then back off. If you want to, what are you trying to do here? I'm trying to go to the edge of your range of motion and then
I
back off a
follow
little
you.
bit. So that's how we're going to improve. And then every visit, the goal is to keep riding the wave of your edge of tolerance. Joints are meant to move, and I'm not asking it to do outside of something it's designed to do. Big marks coming out here. So not everything that causes pain or causes restrictions of a shoulder can be measured on an MRI or seen on a blood test. Do you understand?
Yep.
And I call this the immeasurables, and I think it frustrates a lot of doctors. They want everything to be quantifiable
Sure.
on a picture. They want everything to be seen. But there's a soft tissue bruising component, and that's what I'm working on right now. You're saying this is the component that is invisible on MRIs, but to me is a large factor for why you feel what you feel and your range of motion is the way it is. This is the principle of what we call motion is lotion. The mobility of the joint is what lubricates the joint, is what keeps it healthy. And when we immobilize a joint for protective reasons or pain reasons, it becomes more frozen, creates a positive feedback loop. So you got to go in and try to go to the edge, back off, lay on near the edge of
Edge
the
of
bed,
the bed.
and just let it stretch.
I do that with my right one.
Good. I want you to work on, and then your goal is to, and maybe you put your arm on a chair. You understand? You start raising it higher, and you hold it. That make sense?
Yep.
Like if I held it, it's probably better on a bed, but you got to be able to hold your arm in that position and let that stretch. And you try to go to the edge of wherever that is, wherever, even if it's here.
Right.
You got to go to the edge, and every day you start to, try to go further into your depth of your stretch. You have to sit here and dig, and then comb, and then dig, and then comb, and then stretch, and then dig. It's rounds of it. They're just joints. The surfaces get filled up with sandpaper and grit, and that's what you're running into. That's what causes the pain and the loss of range of motion. Again, that's where the motion is lotion principle of that. You have to do as much care as possible to maintain the mobility, with the understanding that whenever you have surgery or injuries, that you're going to lose some. And surgery to some degree is controlled trauma, right? I mean, there's a scar on you here. I mean, these are controlled traumas, right? They cut you open, and as much as we can say it benefited the deep tissue, we still had to cut through a lot of stuff to get down there.
Yep.
And we had to injure all the stuff superficial to it to get down to the deep layer where they wanted to work on you. And so, but it's an exercise in controlled trauma.
Where's a tender spot?
Yeah, work.
If it's too much, let him know.
No, pain is my friend.
Oh.
Okay. Blood is what brings nutrients in, takes the waste out. Really, the word healing is a misnomer. The real word our body does is called replacement. We term that healing, but it's really not healing. New stuff's made, the old stuff's removed, right? And so that process of replacement requires blood flow. If an area is injured and the circulation is poor, the replacement doesn't happen, there's no healing. And so what gua sha works on is the aspect of blood flow. It's like Publix down here. They combined everything, right? We have a butcher shop, you got a bakery, you got the produce. That's what I did to chiropractic. I put it all in one stop.
Sure.
But many places you go to, you're going to have to go to a gua sha, you have to go to somebody for adjustment, you have to go to somebody for massage. They split it up into different places, and that's unfortunate because it's
all interconnected.
should be all integrated in one. But at the core of it, we need to philosophically start leaving your lower neck alone. That has to be further stressing of the lower neck needs to be, we need to start fasting from I want the upper back. His upper back, I got no motion up here. I hugged you earlier.
Yeah.
I got nothing. Let's fix that first.
Sure.
Then we can worry about C4 and 5 and 6. He has no motion T1 through T4. Get that working first. Like that, all of that. Yeah. Oh man, the nerves that travel to your shoulder have to pass through here.
I can hear it.
I can feel it. Yeah.
Left side was softer, wasn't it?
Yes, sir.
Yeah.
It's a blockade right here. Gotta get this unlocked. This being cleared will allow this to get better. Just working on this without clearing this is silly. That you will ultimately never help the shoulder, and this has to be done. I'm gonna do everything today, but I'm saying this is primary, is this guy. That has to be, like if I had an hour with you and I just want to work on this or this, I'd spend 50 minutes here and 10 minutes here.
Sure.
This would be the majority of our care, would be clearing this first.
And I've noticed my posture's gotten worse in the last 5-6 years as well.
Your body compensating. It's not the problem. Again, that's the result. That's just the effect. If you put something hot in your hands, you're going to notice your hand move. You're going to be moving it around a lot, right?
Mhm.
That's just the effect of having something hot in your hands. You'll stop moving it around if it no longer is burning your hand.
Right.
That's the fix. Once it cools down, if it remains inflamed and hot, then yeah, you'll keep on forever moving it around. Brenda and I were both working on my dad. 13 years old. She's 14, 15, and we're both digging on Dad's back for an hour.
Wow.
I got this section. You get this section.
Right.
We got two people. We got 2 elbows on Dad's back while he comes home in pain. And I remember being like 8 years old, leaving a chiropractic office, and my dad was like, "Ed, I'm gonna teach you how to do this."
Right?
Him being frustrated and so anyway.
Best I could get was my 2 boys walking on my back.
There you go. All right. Yeah, we gotta get this upper back unlocked. Oh man, I got a lot of work to do back here. Jeez. Yeah, I want all this cleared.
Uh-huh.
All this. Come on.
Oh.
There it is. That's the one. Yeah, right here. You're frozen. It's frozen. Your back is frozen. Joints in your spine. I know your shoulder's frozen and it's more easily visible, but this is frozen. These knuckles in your spinal column are just as frozen as your shoulder. All right.
I'm just amazed what you do with your elbow. I'd be on the floor in tears in about 3 seconds.
Come on.
Honestly, I pictured you about 6 inches taller and about 100 pounds heavier.
Oh, I did that. That's a compliment. Thank you.
Does he look that much bigger on you too?
Yeah.
How does this guy put this kind of force through his little mini elbow?
I'm like, yeah. I'm like, wow.
Some people say, "Oh, you're bigger than I thought," and then people are like, "Oh, I thought you'd be taller."
Thanks, I guess.
It's all the camera woman's angle.
That's right.
Shoot low and make him look like a massive giant. I mean, you are 6'2", so.
It's learning how to do a handstand on your elbow. That's basically it. You learn how to focus your pressure through one point, is what my dad taught us. That you're being able to channel your force through one small area at a time.
Mm-hmm.
Like one of those water cutters, like a jet.
Yeah.
It's just one little small area that's very powerful, but it's concentrated in one area.
For me, it was just the motion you get out of your shoulder to do it.
Mm-hmm.
Not so much the elbow,
I got you.
but the shoulder movement.
I got you. I had a chiropractor's father. That's my blessing that nobody else had. That's what everybody should have had spinal care from a young age. I got injured. I fell off my bicycle just like when you fell off your bicycle, but I got adjusted afterwards.
Mm-hmm.
You fell off your bicycle and they said, lay on the couch.
Well, I started at 12, right? My first chiropractor was, I think I was 12 or 13.
All right, well, gee,
That's good.
But then, there was a big gap in between,
I got you.
like 30 years or more.
All right. It should have been mainly around the football years. It should have been integrated with that. Like literally, you get off the football field and you get adjusted. 26 is full skeletal maturity, so it was vital that it should have happened before 26. Whenever the football was up to 26, does that make sense?
Yep.
Once the cement hardens,
Yep.
harder to change things. Not impossible, but harder. It takes more time. You have to sit here and it's pretty boring. And just digging you for hours. And
Oh, and I continued to lift all those years, so
Right.
that didn't help.
Right. Oh. It's all right here. Yeah.
Yeah, it is.
Come on, come on, come on. Come on. I know.
At least it's symmetrical.
That is true. It is symmetrically stiff. It is symmetrically frozen. Both sides of the car are smashed in.
Uh-huh.
Oh, there you go. All right, dog. Easy, easy. There you go. There you go. Take it. Yeah, the more I'm working on you, the more I would spend here and here would be like the first 6 visits would be almost be exclusively. And once we clear this, the shoulder should improve. And then I also work on the shoulder, but 80-90% of our time would be in here. This is massive restriction and misalignment right here, right there.
Do you have any idea how much range of motion he can regain in his shoulder with what the surgeries and stuff? Or?
So part of what's happening is when he tries to raise his arms, he can't because this is pinching. So it's about an MRI of your neck, seeing how much tread, you understand how much we can expect your neck to be able to compress, to be able to lift your arm up. And then yes, the shoulder, is just dependent on the nerves from your neck. And if we make the nerves in your neck happier, then the shoulder will get happier. And then we can clean out the joint in the shoulder. And they all flow together, but it has to begin with this first.
Oh.
The spine has to be cleared. All that goodies in here, exactly, all that.
Yeah, when things got really bad with the knots back there between my shoulder blades, I'd sleep on a spike ball. It's about the size of a tennis ball with spikes all over it. And that was about the only thing that gave me some relief and use of my arm.
We're going to test out in a second. There's a yellow dental that goes in between your shoulder blades. I'd like to test. Have you laid on one of those before? It's a yellow guy? All right. It goes in between your shoulder blades, called a thoracic dental. And just think it might work better than what you're describing, but just compare and contrast it in a second. We'll check it out. But they basically took a lumbar guide, cut it in half, and then it can go in between the shoulder blades. And you're trying to get inward pressure and downward pressure to push these ribs down, give you more space for the nerves in your lower neck.
I did see a chiropractor, I don't know, 4 years ago that he would always put a rib back in because he's like, you got a rib out.
Well, you do, because the shoulders are, your head's forward. It's like as long as your head stays forward, your ribs are out. And we can sit there and toy with the rib all day long. So the head goes forward, this elevates. We call it coupled motion, we call it. And so, of course, your ribs are elevated, and they're not in the right position, but they're in the wrong position because of the ligament. We call it the anterior longitudinal ligament. Has to be stretched. It's all tight on the front, and that's holding you forwardly rotated. And so just popping the rib back down is, to me, ultimately silly, right? Now, we do put the rib back down, but not with the philosophy of that I just change its position. I do it by loosening it so the stretching works. Do you understand? It's not like I'm going to push the rib back in and we're going to
magically stay there.
So it's going to stay there now. That's just is silly. It's just a silly principle that chiropractors have said for 100 years that chiropractors need to swallow the fact that you cannot permanently change the position of a bone by adjusting it. And I don't like that. I wish that weren't true. I wish I didn't have to say that. They don't want to admit it. No, my skilled adjustment will.
Yeah, right.
You understand? Yeah.
It's temporary, right?
It
it's
can't. The ligaments pull it back out. Right.
Mhm.
So what are we trying to do? Well, then what's the purpose then? If you can't change the position, what's your purpose? You're back to the move.
Right.
It didn't function. I got to unlock it. The purpose of the adjustment is to quickly unlock you in a reasonable amount of time so that we can actually stretch safely. To bring your body back to the original alignment that you had as a kid, that we lost because nobody valued.
For the last year, I've been spending, I don't know, half hour, 40 minutes a day laying on a foam roll
Yes.
in 5 different positions in my back
Good.
just to try to
Uh-huh.
reverse the
Good.
curvature.
You're on the right track. I got you, bud. Come on. Yeah.
2.
I know. These guys are functioning here at least, but I know you need hours. I need hours up here. This is supposed to bend just like that.
Used to.
Right. There you go. I spent hours with my dad just holding this whole, this is what the yellow guy I'll show you in a minute, just emulates this, so that the next adjustment we can begin where we left off, kind of idea. We don't take 2 steps forward, 2 steps back, that we can progress. I know, right there, yep.
Mhm.
Oh yeah, nice.
Yeah.
That's some good color.
I need this cleaned.
Oh, the toes.
There we go. I got you right.
Yeah, that one had a bone spur removed.
Gotcha.
But go ahead and pull. That's the one that needs it more than anything, because it's locked.
No, that's right. That's right. Yeah. Yeah. You can tell which one was injured. Yeah. Yeah, nice and loose. Yeah. Okay. Stretch this way. I hear you. Press back a little bit with your elbow. See if you can. There you go. Oh, there it is. Nice.
Yeah, I can do that for you.
Do you see the difference?
Yeah.
Yeah, that's what you gotta work on. You gotta clean out. That was a bit of grit that just.
See, like for me to do this, look at how much I have to bend my wrist to put my hand on
I
my.
understand.
And there was a period I couldn't even put my hand on
Try
my
to put the hand
stomach.
on there. Over stretch for a second. Yeah, there you go. There you go.
Well, this one I can.
This one. Press back with your elbow a little bit. Yeah, there you go. Good. Yeah, you gotta work that out of there. Just working. Just cleaning that surface in there. Press back. Yeah, good. All right.
Oh, the ear.
In here, yeah. Tilt your head right for me. Tilt right, tilt right, tilt right. Okay. Go ahead and tilt to the right for me. Tilt right. Crunch. Go ahead and tilt left for me. Tilt left. And then go ahead and tilt left. Ooh.
Put that in my big toe.
You all right? Oh, okay, okay. Right there. Yeah, right there. All right. Now bend these for me, and then you're gonna kind of push with your feet to have it slide. Makes sense, like you slide upwards a little bit. Get the idea? So it feels like it's pressing in and it's pressing downwards. Does that make sense? I want it on that knot that we felt.
Yeah, I'm on it. The top of the roll's
And
on
then
it.
as long see how the tissue moves. So I want it making its contact and then getting a downward.
Oh, you want me to pull myself down?
You're gonna be sliding upwards. You're going upwards, and it's gonna feel like it's going downwards.
Oh,
So the device, see, that's good. Like that. You hold it like that. You hold it so it's got. See, watch me feel like. You make its contact, and then I want it feeling like it's doing a downward pull.
okay.
At the same time, it's pressing in. It's pressing.
Yeah, okay. I follow you.
All right, maybe roll to your side. Have you roll off for a second. Just roll easy way, like back on your back. All right. So, do you know? Is it a white one you have? Is
Yes.
It, okay. I'm gonna let you.
Put it
go
where
ahead.
I put
yes,
it,
sir.
where I was told to
You
put
do
it.
what you do.
I was told to put it as low as I can get it, right there.
Yes. No. This down. No, sir. Nope. I want it up here at the top. I want it middle upper neck as high as I can. And then what you'll do is you'll take your hand, if you can, put it on your forehead if you can,
Mhm.
and you press. Get the idea?
Mm-hmm.
I want it middle upper neck, and you put your hand back down. Now let's just let it hang out here for a second. I want you to. If your lower neck starts to hurt, then to me, like I said earlier, you're not allowed to do it. You're not allowed to do this.
It's like the roll is pushing on those spines of your vertebrae,
All right, so
and that's what it feels like. It's like it's trying to drive that inward.
I don't want it to feel it in the lower neck. If it feels it in the upper neck, I'm okay with it. But if you
Yeah.
feel it in the lower neck, so it's not contacting your lower neck, but if you start feeling it in your lower neck, then
Don't do it.
you're not allowed to do it. I would argue that you need to be another couple hours of digging and adjustments, and we'll adjust you again in a second, but you need to have the upper neck unlocked and doing most of the bending as it should biomechanically in the first place. 60% of the work is supposed to be happening at the upper neck. It shouldn't. Why don't you have any bone spurs up there? Why don't you have any disc disease at C2, right? It's all at C5, 6, and 7 is where almost all disc disease happens. And if it's age and weight that causes disc disease, how old are the other discs?
Right.
It's nonsense. It's alignment and mobility. The alignment that you're in is putting all the stress there, and that area is the only part that actually works. So why do we want to be making it work more? It needs to be put on vacation, and we align the spine back into a curved position throughout the whole neck, but not by making the lower neck bend too much. We want the upper neck bending. How's that feeling? How's that feel? You feel
Good.
Yeah, should. Let's leave that lower neck alone.
Yeah, a lot more comfortable. I could stay like this forever.
Deep breath in. Listen up. Go. There we go. Exhale. There you go. Chin down. That's all I got.
He's determined.
That's all I got. All the air bubbles are gone. I've already pushed all the air bubbles out. We'd see improvement every visit. All right, I got you. Easy, easy. Relax. Good, very good. Yep. I got you. I got you. Relax here. Chin up. There you go. I know we beat you up pretty good, but yeah, just give that a shot. See, how's it feel just generally right now? How do you feel?
Good, loose.
Feel less loose?
Yeah.
All right, let me show me, look up for a ceiling again. Yeah, nice. Your neck is nice and bending now. Much better. I mean, that's like me.
No, nobody's like that.
Thank you.
It's pretty
That's
good.
pretty good. I mean, it was pretty good before, but that's better.
Yeah. How's it feeling?
Good. I mean, it still feels like I'm
frozen.
hitting
Oh, yeah. Yeah.
a stop.
You're doing 20 minutes in one spot in one session. Then the
Okay.
next night you get on a different spot. But my point is with your shoulder, I want the arm
Yes, I understand.
20 minutes. As deep as you can handle. And that's the other ways they have, exercise. Maybe you've been through a physical therapist like with this where they have you,
Eyes, Y's, and T's. Oh,
The
yeah,
stuff.
yeah, yeah. I do the crawl or the paint.
Right.
Yep,
and you're trying to come closer to the wall.
yep.
But the main thing is you're going to the edge, wherever that edge is, and you hold, and then you're inching your way up, but you're holding it.
Because I do that. I do the wall walks and all that. The problem is I find a way through it, right?
Show me. Now start walking forward. You start stepping forward. Yep. Good. All right, good. Move the feet closer to the wall. There you go. Good. How difficult is that? The arms, shoulders hurting, or
Right one. I've hit the stop.
hit the stop? I mean, you want to hang out there. So,
Yeah, so I'll do that. I'll do the doorway stretch.
And the abduction one. That's the next one. Is try this guy.
Yeah, that one's no fun.
I know. I know. Come on. Then you stay there. Then don't go any deeper. Then you stay right there. And you try to go to that edge. As long as you're going to the edge, you'll work that. But you do have to lean into it and try to go up another half inch or something like that. Exactly. Start and then stay there. The MRI of the shoulder. I mean, how much that bone spur that's grown back after they shaved off. I'd be curious how much of that is limiting. If you're literally running into that bone spur.
Well, it's on the underside, but like when I do anything like this, it's square. If you look at the head of my humerus, it's square in a circle, and it just grinds, and it's loud. Like anybody who goes by me, walks past me, they can hear it because it's grinding.
I mean, long term, it's the spine that I want cleaned first. The shoulders are going to be secondary. If they do talk, have they talked to you about shoulder replacement? Is that what they want to do? They want to go in there and resurface the whole thing and put a
new capsule, the whole thing. Yeah.
I mean,
Which I'm trying to avoid.
Having, this is where again the chiropractors I'm sure having this conversation with you already because to me the only people who need back surgery are people with previous back surgeries. Once you start on the road, it's difficult because of the damage that's done and what your body adds to it. It's hard to conservatively clean it out now. If you didn't have any surgery, it's easier to go through this process of restoring it with the more conservative range of motion stretches. But I have enough in your back that I'm more concerned about, like I said, the back surgeries and stuff like that,
Sure.
the lower neck, how worn out that is because your upper back is so tight, the upper neck. So, pleasure, my friend. You did really
Yes,
good.
thank you.
All right, very good.
You're awesome.
Thank you. Thank you.
Good job.
No, this was awesome. It was great.